So welcome everyone. We'll get started in just a minute as we wait for others to join us. Hi, Dr. Yanez, how are you?
Hi there, I'm well. How are you?
I think you were on mute. Can you try to say something again?
Check, check.
I'm not able to hear you, and I do have my volume up. I hope it's not my computer.
That's
Oh,
odd.
there we go.
I
hear you now.
okay, because I've been on Zooms all morning, so it's been working.
Yep, it's working fine now. Maybe it just took
Okay.
a minute there. Okay, so we'll get started in just a minute here as we wait for others to join us. Feel free to say hello in the chat and mention where you're from. We always like to see where people are calling in from, usually all over the country, sometimes other countries as well. And we'll get started in just a second here.
Hello.
Hi there, how are you?
I'm well, how are you? I'm tuning in from the state of Maryland.
Oh, Maryland, wonderful. Is it pretty cold there right now?
It is.
The weather is beautiful here in Arizona, so.
I see.
Okay, great. Well, I think we'll go ahead and get started. So welcome everyone. My name is Sarah and I work in admissions here at SCNM. And for those of you who are joining us today for the first time, these virtual discovery chats are something we do every couple of weeks or so to give you more information about our naturopathic medicine program and really all that we have to offer at SCNM. We often have guest speakers such as students or alumni, and today we are very lucky to have Dr. JoAnn Yanez joining us today, and I will introduce her in just a moment. But I do want to mention that I will start by asking Dr. Yanez a few questions to get the ball rolling, and then we will open it up to all of you to be able to ask her any questions that you like. So you're welcome to ask the question in the chat and I will go ahead and read it aloud to her, or you can even turn on your camera and your mic and ask the question that way. So Dr. Yanez actually graduated from SCNM and she is currently the Executive Director of the Association of Accredited Naturopathic Medical Colleges. She has a very—
Do you want to have this recorded?
It is recording, yes.
It is recording, okay, perfect.
Yeah, thank you. Yeah, and she has a really interesting and wide-ranging background, also serves on a number of committees that deal with integrative health, advocacy, a number of issues like that. So we're really excited to talk to her today. So Dr. Yanez, thanks so much for joining us.
My pleasure.
Well, I want to start by just asking you if you could tell us a little bit about yourself and how why you chose to pursue a career in naturopathic medicine.
Of course. So I was one of those students who always wanted to be a doctor. When you asked me as a kid, what do you want to be when you grow up? I would say a doctor. Actually, my answer was a singing doctor, but that's besides the point. And so in my mind, I thought my career was going to look like the docs that I had seen. I had a big interest in mental emotional health. And so very much thought I was going to be a psychiatrist. So I planned all throughout high school. I did things that would, give me experiences in that world. I was a peer leader. I womaned a teen suicide hotline, and then got into college, got into a great pre-med program. And the summer after my freshman year, had arranged for a research internship at the psychiatric hospital. So again, all of these things kind of lining up to prepare myself for a career as a psychiatrist. And within moments of being in the psychiatric hospital, I just knew it wasn't for me. It wasn't that it was a bad place or dangerous or anything like that. It was just like, do you ever know, like when you have a feeling something just isn't a fit? And so for me, it was really a turning point of, well, oh my gosh, I've been planning for like the last bunch of years that this was what I was going to do. And the things that didn't fit for me really were very much related to naturopathic medicine, but I didn't know naturopathic medicine was a thing. And so I wanted to be a doctor that used nutrition. I wanted to be a doctor that recognized the power of the mind and the body. I wanted to be a doctor that looked at the reason why diseases, especially mental health diseases, were showing up in the first place. And so to see the conventional practice just didn't feel fulfilling to me. So I looked and I searched, and I don't know if you can tell, but I'm old enough that this was all pre-internet. And so the searching was harder, but I searched and I finally talked to this doc who said, you know, if I had to do it over again, I'd be a naturopathic doctor. And he said, a natural what? And never heard the term. And he started to describe it, and it was like the light bulb went off, the angel sang, like, this is what I was looking for, and I just did not know existed. So at the time, SCNM was a very new school. They had just been open a couple years, actually not even a couple years when I went to interview. And so I got on a plane, I went to Arizona, and the rest is history. And so that's kind of my journey to getting myself here as an ND.
Wonderful. Yeah, well, thank you for sharing that. And so I know you've been in this field for a while now. So can you tell us a little bit about how naturopathic medicine has evolved over the years and what you think the future holds for this career path?
So it's really amazing to see the growth. You know, there were just a handful of schools when I first joined the profession, when I first started as a student. In fact, SCNM wasn't even in its gorgeous campus that it is now. We were in an elementary school that was being rented to have some classes. And so, you know, there's just been so much growth, and it's really amazing to see, you know, 6 new licensed states and jurisdictions in the past 6 years in the US. And it's just growing, and so many opportunities that I don't even think my classmates and I could have imagined. NDs on New York Times bestsellers lists, NDs running, you know, multi-million-dollar companies, and NDs in the news, NDs writing books, NDs creating skincare lines, and all sorts of things that our grads are doing that are just amazing and groundbreaking. And so I don't think that any of us could have imagined all of that, you know, 20 plus years ago, but it is really amazing to see it in progress and to see the growth.
Wonderful. Yeah, it is an exciting time. I don't know. I think Dr. Alan Christensen maybe graduated shortly before you did.
Before me.
On the bestseller list and is very well known. One of our first graduates, actually. So yeah, that's great. So what advice do you have for our prospective students who are interested in a career in naturopathic medicine?
So, you know, I think deciding any career, any education is an investment. It's an investment in yourself. It's an investment in a career, you know, potentially 30 years of earning potential. So, you know, or more, depending on how long you plan to practice. And so I think for folks, I always advise to go into this like it is an investment. How are you going to use this degree? What does it look like for you? Start to think, you know, you wouldn't just invest in a business without understanding the business. So what are the things that excite you the most about this, and how are you going to use it? One thing that I have seen in counseling students over the years, the successful folks make a plan. It doesn't have to be all, you know, everything perfectly worked out, but they do have a plan, and they start to network, and they start to think about it early on. It isn't too soon, even right now, to start thinking about, okay, what is my life as a naturopathic doctor going to look like? And what do I need to do to get myself successfully there? You know, if you want to be practicing or working in a certain field within naturopathic medicine, start networking with those docs that are doing it and doing it well. If you want to be more entrepreneurial, you know, make sure that you have the business background to understand how to be an entrepreneur. So there are so many different pieces of things, but I think that really just understanding yourself, knowing how you want to use this amazing education, and putting together a plan to be successful. Because the folks that I've seen who have really rocked it, they start early, they're networking, and you know, they're not waiting until they're just about to graduate before they're, you know, pretty solid in what they're going to be doing with the degree.
Wonderful. Well, I just want to take this opportunity to open it up to all of you. If you have any questions for Dr. Yanez, you're welcome to turn on your camera, as I said before, and just ask that way. Or if you want to write your question in the chat, I'll go ahead and read it to her. It looks like we have a question. Zarina, do you want to go ahead?
Hi, my name is Zarina. Thanks so much for your intro, Dr. Yanez. I do have a few questions. So for me, my background is in pediatrics as a healthcare worker. I'm also a small business owner. And so my goal was to have my own pediatric wellness center in the future. And I wanted to know I've never met a naturopathic doctor in pediatrics.
There are plenty. I know SCNM has a number on staff, and I believe, do you still have the honors track in pediatrics as well?
Yes, we do have an honors track in pediatrics, and Dr. Matthew Burrell has been a naturopathic doctor, I think, for 20 years now. And he, as a student here, you can have clinic rotations with him in pediatrics, definitely, and others as well.
So there is the Pediatric Association of Naturopathic Physicians, PED-ANP. So Zarina, is that how you say it?
Yes, it is. Thank you.
That I would definitely recommend checking that out and starting to network. So there are absolutely docs. You'll find that a lot of NDs, especially those who are in primary care, may see pediatrics in addition to other ages, but definitely there will be folks who are seeing predominantly or solely pediatrics.
That's amazing. Can you please tell me the association one more time so I can write it down?
I'll put it in the chat.
Thank you.
You bet.
Thanks, Dr. Yanez. I was just going to look it up. And if anyone is having a problem hearing me, just let me know. I'm afraid my connection might be a little unstable, but hopefully it'll be fine. Great. So I do have a couple other questions here, and thank you for putting that in the chat. So can I start the program online, as I do not live in any of the school's locations?
I don't know if you want to take that in relation to your program. I can speak to other programs, but I don't know if you want to talk about SCNM that way.
Yeah, so for our program, it is going to be in person for all 4 years. So we do require students to live here in Arizona for all 4 years to attend the program. I believe there is one other ND school where the first year you can do it online, but for the most part, it is a very hands-on program. It is essentially medical school. You know, we have labs, we have clinic rotations, all that sort of thing. So yes, it is going to be an in-person program. And most of them are out west here. There is only a handful of accredited naturopathic medical schools in the US. Yep, so the next question here is, what are the differences between ND and DO, and why would one choose to become an ND?
So I put a link to an AANMC document that compares a bit about the different educational pathways. And I am the executive director, so full disclosure, I am the executive director for the Association of all of the accredited colleges. So this is a website that we put together to help prospective students understand the basics. And so really, I think when I think about the differences, I can speak very well to what we do. And I always tell students, if you have questions for other professions, it's best to direct them there rather than, hearing from me. But what I can say naturopathic medicine does really well is we are fully dedicated to holistic integrative therapies from day one. That's what you learn in ND school. And so if you are passionate about a career in, using the least force types of therapies, really diving deeply into the integrative therapies like nutrition and botanical medicine and mind-body medicine and hydrotherapy and manipulation and all of the things that we get in ND school, you are going to get that very deeply gone into in ND school, whereas other educational models are based much more in a conventional type of framework. And so while you are definitely getting the biomedical sciences, anatomy, physiology, biochem, et cetera, in your foundational coursework for naturopathic medical school, even those classes, like I remember as an ND, even my anatomy class, it was still, there was still a resolution of the interconnectedness of the whole body. It wasn't just, okay, now we're studying the leg and now we're studying the arm. No, we're studying how like dysfunction in the leg can impact your head and everything. And, and we used to joke, the knee bone's connected, it's all connected. And so I think the lovely thing that you get in naturopathic school is this amazing focus and amazing faculty that are fully dedicated to integrative medicine, whereas in other models, like I said, it is more conventional in the education. You'll be in hospitals, you'll be in other types of very conventional settings. So there, depending on the osteopathic school, there may be various degrees of focus in integrative medicine, but it is not the core throughout every component of your clinical education and your academic education like it is with us.
Great, thank you for that. And so while we're waiting for other people to ask more questions in the chat, or you can raise your hand as well. So I just want to ask you, Dr. Yanez, I know you represent all of the naturopathic medical schools, but as a graduate of SCNM, if I can ask you to be maybe a little biased right now, what do you think sets SCNM apart from the other schools?
Oh, that's a tough question. I think when I counsel students all the time ask me, like, what is the best program? And I, there is a best program for you. So there is always going to be a best program for the person. And when you are a student, I know the pandemic has made it tough for some people to travel, but I definitely recommend traveling to the individual programs that you're interested in, because like I felt at that first day in the psych hospital, like there are often times where you're going to feel an instant connection, or, wow, maybe this isn't the place I thought, or this isn't the place for me. And so, I think there are so many things that each of the campuses does well. And there are so many things that SCNM does well. And, I think it's really exciting to see your research center and, all of the Botanical Research Center, the Neil Reardon Research Center that is up and running now, the clinical education that happens in the Southwest, the focus on the Southwest Botanicals. There are so many things that are unique to this location. But I just encourage you all to find out, what is it that you want to learn? So in the case of, Zarina, who was asking about pediatrics, ask about the pediatric education. If that's really what you want to learn, and I commend you for being so laser focused on it, then ask those questions. What type of education am I going to get here? Who are the individuals I'm going to be exposed to? What are the things I'm going to learn? What are the settings I'm going to learn in? Talk to me, tell me what it's going to look like. And, and go visit if you can, because it really will speak to you so much more loudly, and you can see the students for yourself and see the campus for yourself. And there's really no substitute for that. So SCNM does things amazingly. And it's so much more of a campus than the one that I graduated from. It's a beautiful campus. So I definitely encourage you to go to and visit the campus or campuses that you're interested in.
Yeah, thank you. And that's a great point. We do always encourage students to visit all the campuses if they can, and, see what resonates and see what's a good fit. And we are starting to open the campus tours a little bit more now. So please do reach out to us if you'd like to come and schedule a campus tour. We'd be happy to show you around, as Dr. Yanez mentioned, our new Botanical Research Institute and the Neil Reardon Center for Regenerative Medicine. So a lot of exciting things going on. So great. Okay, so we have another question here. So I also have another question. How would one use an MD degree in unlicensed states?
So I'm actually going to pull up the AANMC's resource here for licensure as I'm talking. So there are, for those of you who aren't aware, so naturopathic doctors in the US are regulated in 26 jurisdictions, and the regulation, and there was a follow-up to that question of, what's the barrier to new states coming on? So legislation is state-based in the United States. It's done on a state-by-state basis. Each state legislature has to pass the legislation that would then detail the scope of practice, the educational requirements, and so on. And I've been involved in various different components of that across the US. And from there, when you are in a state, states like Arizona have very broad scopes of practice. And so there is a lot that you can do underneath the ND license. And then other states have maybe different scopes. And so you always have to just understand what is the scope to legally practice where I am. For a number of years, I was in New York, and New York is still pre-licensed. It was pre-licensed back in 2003 when I moved there. Gosh, I can't believe it was almost 20 years ago. But there are many docs who have been in New York for decades now, practicing successfully, working successfully, some SCNM grads from other programs. And there are so many different ways to work within pre-licensed states. It very much depends though where you're going. And to understand it I always recommend speak to docs who are currently there, talk to the state associations so you understand the playing field of what it is like to work there, so that you can do so safely and legally. And but there are many ways of working in pre-licensed states. I know for myself personally, I had a consultant practice, and so I wasn't, physically in practices like I would have been in Arizona, but I was doing a lot of consults. I was teaching, I was doing public health and policy. There were a lot of things that I was doing. Got involved in the HIV community in New York. So there are so many different things that you can do and a lot of opportunities, but it really is going to vary. For those I found in New York practicing, it was helpful to have another degree like an acupuncture degree or a chiropractic degree so that you would be able to have malpractice and bill insurance, but other states are different. And so it really does depend. And I think one of the cool things now, if we can find any silver linings from the pandemic, is that the practice of telemedicine has increased. And so there are various different telemedicine laws now. And I think the government the local governments are playing catch up, honestly, with telemedicine because the practice got out ahead of what the laws allowed for, just out of necessity from the pandemic. And so there are a lot of ways that you can work and live in a variety of different locations.
Great, thank you for that. And thank you for sharing that link in the chat where you can see a map of the United States and what states are licensed and what are not licensed yet. Like we know just a couple of weeks ago, Wisconsin became licensed, which is wonderful. And I'm including, I just made a comment right there in the chat. If you want to email me, and I can recommend one of our graduates practicing in your state, whether you're in an unlicensed or pre-licensed state like Texas or Ohio, or you're in a licensed state. I'd be happy to email you some of our grads practicing there if you want to reach out to them to shadow or become a patient or just ask them a few questions. So that's great.
So there was a question from Michelle about homeopathy. I will leave the SCNM specific questions to you, Sarah. So I defer to you to answer that.
Okay, yeah, I did see the question. So the question is, I think I heard somewhere that homeopathy was being phased out of SCNM or perhaps other ND programs. Is this correct? If so, what is the reasoning behind this choice? So I actually have not heard that. So that would be news to me. I mean, I know we've had homeopathy has been part of our program for a long time, especially with Dr. Stephen Messer, who's very renowned in the field. But other than as far as that goes, I don't know anything. Dr. Yanez, maybe you know a little bit.
Yeah, I'm not familiar with that either. Dr. Paul Mittman, who is the president of SCNM, actually was originally a naturopathic homeopathy guru. He taught my homeopathy class before he became president. So I'm not quite sure where that's coming from. So I can't really speak to that.
Okay. So let's see. I don't see any other questions here, but again, feel free to ask away or turn on your camera. And if there are any questions about the requirements, the prerequisites, I can certainly go into that as we get closer to the end of this discussion. But I want to make sure that you all have a question, have the opportunity to ask Dr. Yanez questions about the field, what it's like to be an ND, what the possibilities are like, all that sort of thing. Oh, here we go. So she says, sorry about the confusion about homeopathy. Here's another question. I recently went to a Zoom meeting via SCNMs about NDs without borders. I'm wondering how you deal with first-year student wanting to participate in this program. So yeah, I mean, you are able to volunteer with Naturopaths Without Borders even from your very first quarter. Sometimes they even accept volunteers before they're a student, like maybe, well, because what Naturopaths Without Borders does, I'm sure you've heard of Doctors Without Borders. And Naturopaths Without Borders is similar in that they go to often different countries. Maybe it's Mexico, Haiti, Thailand, and work at clinics we have established there, often serving the underprivileged population. And it's a wonderful way to give back to the community and practice your clinic skills. And Naturopaths Without Borders was actually started right here at SCNM, I think maybe around 15 years ago or so. It's since expanded to the other schools and around the country as well. So it's a great organization to get involved in. And yeah, as a student, you can definitely volunteer. And even before you're a student, feel free to reach out to them, see if they need help with maybe being a Spanish translator, or if you have any prior clinical experience that could be helpful. I don't know if you want to add anything, Dr. Yanez.
Yeah, they go to Haiti as well. You know, with the pandemic, I'm not sure of the speed or types of trips that are happening. There's also Natural Doctors International that was founded by an NUNM grad, and they practice out of Nicaragua, which has had some political issues recently. But there is a lot of practice. The other resource that I would turn you to is the World Naturopathic Federation. If you're interested in global practice as a naturopathic doctor, the WNF, the World Naturopathic Federation, is another organization that convenes NDs from across the globe. So lots of opportunities if you're interested in more of a global practice, and there are NDs from North America practicing in many different locations around the globe.
Right. Yeah, definitely lots of opportunities if you're interested in global health, giving back. And yeah, I don't know that Naturopaths Without Borders has been to Haiti recently. I think they've done a couple of trips to Mexico recently, which from our location in Arizona, it's only a 4-hour drive south. So they would go there maybe once a month, once every couple of months prior to the pandemic anyway. All righty. So let's see here. I have taught, and so Dr. Yanez, I see you wanted to make sure that the students are aware of upcoming AANMC events that are hosted monthly. So thank you for including that link. So everyone feel free to check that out and look at some other events that you can attend.
And we also archive events too. So like folks that are interested in pediatrics or gastroenterology, we have, and I know SCNM does too, but we've got resources of webinars dating back years. So there are archived events there. If you want to, see if you're a career changer, we have archives of that. If you are interested in cancer, we have archives of that. So lots and lots of archives of various different ways that NDs practice around the country.
Great. Yeah, wonderful resource. Okay, so here's a question. I have talked to some NDs that have said they cannot do shadowing because of telemedicine right now. Will there be more opportunities that might possibly open in terms of shadowing as more laws for telemedicine are set in place?
I know the pandemic has definitely made shadowing difficult across all health professions. So I'm on a board, Federation of Association of Schools of the Health Professions, that has every health profession represented, including medicine and dentistry and veterinary medicine and so on. And shadowing has been difficult throughout the pandemic for everyone. So if there's any comfort in that, just recognize that it's not just within naturopathic medicine. This is across the board. That said, I know Sarah has a list of docs and folks that she can help, connect you with to shadow and to make that a little bit easier for you so that you're not just cold calling people. A lot of docs, even if they're not able to have you physically in the office because of the pandemic or because their practice has shifted some, might be willing to have a 15-minute virtual tea with you or something like that. So, there are plenty of ways to connect with people, that I'm sure Sarah will be able to help you with.
Yeah, that's exactly right. So that's what a lot of our prospective students have been doing over the past couple of years. If you're not able to shadow, then a lot of naturopathic doctors would be willing to have, like she said, a short Zoom or phone chat with you where you can ask them a few questions like, what is it like to be an ND, or what does a typical day look like for you? So that can be really helpful as well. And yeah, like I said, just email me what state you're in, and I'd be happy to send you some of our grads practicing there. Or if say you're in a pre-licensed state, but you're open to living somewhere else, like maybe you want to end up practicing in Arizona or California or wherever it might be, then I could send you some of our grads practicing in those states, and you can reach out to them via phone or Zoom.
So a typical day for an ND, honestly, for me personally, there is no typical day. Every single day is different. And I love that about my current job. When I was practicing, life as a practicing doctor can look a lot of different ways depending on the type of practice that you're setting up. But we have, and I'll find the link to it, to the data, but majority of NDs are in either private practice or group practices where they're doing outpatient care. So what that's going to look like for most folks is you show up to the office, and maybe if you're doing telemedicine, you don't show up to the office, you show up to your place where your computer is with a secure telemedicine platform that you can see patients on. But either way, you're going to be interacting with patients. And I think the things that are special about naturopathic medicine and maybe different from the conventional interactions that you might have had is the amount of time that you're usually going to have with your ND. And so I know my colleagues love the fact that they get to really dive deeply in with patients in their patient care, understanding why illness is showing up and helping them to uncover the root cause, as well as to take steps to empower them to get well. So there's so much within that. Some NDs will have a practice that focuses on physical medicine or procedures like injection therapies and acupuncture. Other folks may have more of a counseling style practice. Other folks may be serving as primary care docs and ordering labs all day long and doing physical exams and making sure that their patients' chronic illnesses are managed. So there are a lot of different ways that looks like. The majority of folks see in the 8 to 12 patients a day range. So it is significantly less than the conventional counterparts because we're spending so much time with each patient. And some people choose to do that a few days out of the week, practice maybe a little bit longer days, and then have a day to do charting or a day for more administrative work. Some folks will practice 5 days a week. It really varies depending on the practitioner. But I think one thing that I hear from my colleagues, and I've heard from the countless NDs that I've interviewed over the years, is they all enjoy the flexibility of being able to make their day and set up their career the way that they want to practice and the way they want to be a doc.
Okay, great. And I see we have another question from Zarina. I'm sorry, is it Zarina or Zarina?
Zarina.
Zarina. Okay, yes.
Thank you. I want to know, does the ND curriculum include aromatherapy and herbology?
Botanical medicine is absolutely core to that. Aromatherapy may be covered, but you're getting into a lot more of the medical applications of botanicals. You really get into the biomedical pathways of like, why does the botanical work? What are the mechanisms of action of the botanical? What are the contraindications, indications for it, and so on. So it's a lot deeper than like, here, take this herb for headaches.
Right. Thank you so much.
Mm-hmm.
Yeah, and just to mention again, if you are interested in botanical medicine and also interested in research, we do have a wonderful research department and new botanical research institute where students, along with our researchers, are doing wonderful research and projects. Often they're collaborating with researchers over at Arizona State University here in town. So lots of opportunities. I mean, we've had students published in peer-reviewed journals, students who've given presentations to medical doctors at conferences that are around the country. So lots of great opportunities. Okay, great. So I see we have some other questions here. After graduating from SCNM, what opportunities for continuing education in naturopathic medicine look like?
So there are there's a lot of continuing education. And I think any commitment to any of the medical professions is going to be a commitment to lifelong learning. I just paid for this morning, continuing education for myself in administration administration, you really do just commit yourself to a career of lifelong learning. So there's continuing education through state associations, through national associations, there are specialty associations. It really depends on what CE you want and need. And so, but there are so many opportunities. I've taken classes alongside MDs and DOs. I have gone alongside my ND colleagues. So there really is a lot available to you for continuing ed.
Thank you. So the next question is, are there any limitations upon graduation for much older students in their 50s, 60s, et cetera, that you are aware of, such as residency, clinical practice, teaching, research, et cetera?
So I was the baby in my class when I started 25 years ago. But in my class, we ranged from 22 to 50s. And so there really is no age limitation for knowledge. And I think just dig that in. Some of the most amazing classmates were the older ones because they were very focused. They knew how to study. They had their priorities straight. They were, not easily swayed from their goals. And so, I think I posted a link here to Career Changers. We have hosted a number of different webinars with career changers at AANMC and folks that started out in different pathways and changed. And many of them have gray hair. So it's not too late to be an ND if that's what your passion is. Don't let anybody tell you can't go to school. So I think those things are really, just up to you to make it happen, honestly.
That's right. Okay, what advice would you give to someone who is on the fence between becoming an ND and a PA? Of course, a more naturopathic oriented one.
How do you want to practice? A physician assistant is a physician assistant. Do you want to practice as a standalone physician where you are making your way? And, it's really what is important to you and how do you want to work with patients? I think the amazing thing about ND school is all of the integrated medicine you learn. And so if you're really passionate about that, that's what you're learning in naturopathic medical education. If you went the conventional route, you would I don't want to say unlearn, but you would have to then learn all of the things that you wanted to learn. And so it would be a lot longer educational course for you and maybe a little unlearning.
Okay, so next question is, in addition to traveling to each program of interest, is there an opportunity to have counseling session about what school might work best based on interests?
I think you do that with the admissions counselors. So, you set up conversations with the admissions counselors at any of the school or schools that you're interested in and have your questions ready, have your questions ready. If you shadow at the school, if you go and visit the school, talk to students, talk to, folks in the hallway. If you can, there will be student ambassadors to speak with, what are the things that are important to you in your education and your location of education, and find those answers.
That's right. Yeah, we're always available to chat with you and student ambassadors as well if you want to get a student perspective too. Okay, the next question is, if you could go back and do something different, what would it be? Do you have any regrets about any career decisions you have made?
I don't have regrets about career decisions, but I wish I had mentors early on. There are a lot more folks that look like me now in the naturopathic profession, but there wasn't as much minority representation early on. And I really wish that I would have had some mentorship, honestly, to help me. I was very clear in the types of things and the vision that I had for myself as a practitioner. I knew that I wanted to be in administration, but I didn't really know how to get there. And so I do wish that I would have had more mentorship. I don't have any regrets. It just, my career path was a little more circuitous and not quite as straight as maybe it could have been had I had more clear direction. Like I found out through accident that I loved working in public policy, and I didn't even know health policy was a thing. Like I was, pre-med, now they call it pre-health, but I was pre-med. No one ever talked to me about health policy or public health or anything else. I'm one of those people, potentially be in school for the rest of my life. Like, you know, if I would have also have loved a law degree. That's just how my brain works. But, you know, I think that I don't have any regrets. My main thing, if I could have told my younger self, would have been make sure, go get mentorship. And I would have knocked my head against the wall. Go get mentors. It'll save you a lot of years and a lot of, you know, trying to find answers.
Great advice. Okay, the next question is, how likely or common is it to integrate clinical practice with teaching and research?
Very, very. So many of my colleagues are doing exactly that. I taught nursing school. And was practicing in New York. And so there are so many different things to be able to manage that. So lots of people do that, not uncommon at all.
Great. So next question is, I want to be an entrepreneur ND and own my own business. Which experience is best for me? Private practice, research, clinic, telemedicine?
So, you know, entrepreneurship can look so many different ways, and there's so many different businesses. I would maybe have you get, you know, some mentorship yourself and have some business coaches. You know, what are you passionate about? Like, what are the things that you research, that you look into, that jazz you, that excite you without anybody having to ask you to do it? And I would start there. You know, owning businesses is a big undertaking, and you really should be doing something that you're passionate about. So there are so many different ways. There are NDs who have opened up supplement companies, NDs who have founded concierge practices, NDs who open up clinics. Run. I was just texting this morning with an ND who has a whole skincare line. You know, there are so many different people that have set up entrepreneurial endeavors as naturopathic doctors, but it can look so many different ways. So you really do need to do some soul searching and find out what is of interest to you.
Okay, great. So we have about 5 minutes left in this chat, and we have a few questions. So we'll try to get through the ones that are listed here at least. So do you feel like finding a career within the ND community is very difficult to find?
I don't, but I will caveat that for, you know, people who take the time to you know, really start to network and understand all of the different ways that you can be an ND. I think for some people it's almost overwhelming because there are so many different ways that you can show up as a naturopathic doctor. You can be an employee, you can own a business, you can do so many different types of things. So I think for some that can actually be a little overwhelming because there are so many different ways that you can do this. So I don't necessarily think it is hard. I think what might be hard for people is getting focused. And so, you know, the more that you can do yourself to focus yourself, okay, do I like pediatrics? Do I want to focus on mental health? Do I want to focus on primary care? You know, what is it that you want to do? And then once you can get clear for yourself, then it becomes a lot easier.
Definitely. Okay, and the next question is, what experiences would be most helpful prior to beginning ND school?
Oh gosh, you know, get clinical experiences if you can, learn about yourself, you know who you are, know how you study. One of the, I'm going to put my teacher hat on for a second. It is medical school and it is rigorous. And so you need to have your study habits down pat before you get to ND school. I would definitely say have that clear, know how you learn, know how you study, know how you absorb mass amounts of quantities of information quickly, best, and get good at that because I don't want to scare you, but it is medical school and there won't be a lot of time and leeway to figure that out if you haven't already figured it out before you get there.
Okay, great. And on a side note, because we are just about to wrap up here, in the chat, I included my email address again. If anybody is interested in a free transcript evaluation, we'd be happy to review your transcripts, let you know what additional prerequisites you might need, what your next steps are, or if you just have any questions for me about the admissions process, feel free to reach out. So I do see another two-part question here that we want to address. I think I'll maybe start with the second part to this. This person says, I want to become an ND, but my dream is to work for a cancer clinic where a group of NDs come together to aid the patient. So we actually do have a clinic just like that here in the Phoenix area. Dr. Daniel Rubin is one of our graduates from SCNM, and he and several other doctors do focus on naturopathic oncology. They primarily see cancer patients. So that certainly is a possibility. I don't know, Dr. Yanez, if you want to add anything to that.
Yeah, I put the link to the Oncology Association of Naturopathic Physicians, which Dr. Rubin founded. So AnkiNP is, they actually have a symposium every year. It used to be in Phoenix prior to pandemic for naturopathic oncology, specifically naturopathic oncology. And you can gain a fellowship through the Naturopathic Oncology Association as well. So if onc is really your thing, I would definitely say to look into that further.
Yep, and you're welcome to, Google Dr. Dan Rubin and research, their clinic, maybe reach out to them if you have any questions. And I see the other part to that question is, what do you feel is the coolest or neatest thing that you have experienced since you have received your ND career?
I think the thing that always sticks with me is seeing patients who have been told that nothing is going to work for them, or it's in their head, and then you see them get better. And I think that is honestly the neatest thing is watching and being a witness to healing every day.
That's wonderful. Well, that's a great note to end on. So yeah, thank you, Dr. Yanez, so much for joining us. We really appreciate it. I know you're just a wealth of information and have a wonderful experience to share.
Thank you all so much. So I'm just leaving the link to the AANMC there. Have a great day and best of luck to you all in your journeys.
Thanks, everyone. We'll see you in a couple weeks. Take care.
Bye.
Thank you.
Thank you.